Good morning, and welcome to episode 1 of Build Back Better, an interview series designed to share the perspectives and insights of education leaders from a variety of contexts. My name is Greg Teresfudis, and on this platform, we will highlight viable solutions working to keep children safe, engaged, and learning during this unprecedented time, as well as share what is needed on the ground. Our goal is to help education leaders to shape, refine, improve, and contextualize the support they are providing to vulnerable populations in Thailand and Myanmar. Today, I'm joined by Dr. Ashley Clayton Hertz, a consultant and adjunct instructor at the College of Education at the University of Massachusetts Amherst. Today, Ashley will speak to her previous work in Sierra Leone, West Africa, where she was working with the International Rescue Committee and completing her dissertation when the Ebola outbreak occurred. Ashley's primary work was disrupted due to the prolonged school closures caused by the outbreak. During that time, she supported education continuity planning, safe school reopening, and rollout of the national accredited syllabi with a variety of organizations. Welcome, Ashley. Ashley, hello. How are you doing?
I'm good. How are you?
Doing well, thanks. Thanks for joining us today.
Oh, happy to be here. Thanks for hosting this.
All right. We'll get right to it. So my first question for you is, what lessons were learned about safe school reopening from your previous experience working in the wake of the Ebola crisis?
Great question. Thanks, Greg. First, I just want to emphasize that the Ebola virus was a bit different from COVID-19. It was easier to understand how it was transmitted and to detect symptoms, so safer school reopening was a bit easier than it might be in the situation we are now. Also, schools were closed for a much longer period of time, which allowed more time for planning. At the time, though, there was limited guidance of what we should do with schools and during and after the outbreak. But obviously, since that time, several lessons have emerged from all the countries which were affected, which have informed a lot of the guidance that you might see coming out now for schools around the world. I thought that I would share a few that resonated with me from my time in Sierra Leone during that time period.
Great.
The first one is that schools definitely need to be properly prepared to be clean, safe, and free before opening. And if not, they do not need to be open. This requires advanced planning and preparation and strict adherence to the health and safety protocols, starting with proper risk assessments of schools. Some schools or learning centers may have more risk than others or need more time before reopening, or they need to be reopened in different stages. In Sierra Leone, the level of preparation needed for school preparedness varied depending on the circumstances. Some schools served as treatment facilities during the outbreak or isolation wards. So those schools had to be properly sanitized and then resupplied and refurnished before opening. So it will vary depending on the situation of schools. The second point that I would like to make is around community trust and engagement. This was critical. Parents and children were scared to come back to school and were not really confident that they would be safe. School leaders had to not only ensure that schools were safe by following the strict protocols, but they also had to make sure that students, teachers, staff members, and the community felt 100% confident that they would all be safe. So for this, community messaging was important, and engagement of community and tribal leaders, in the case of Sierra Leone, was critical. The other point is to plan for teacher and student movement and attrition. During the crisis, teachers and students moved to different communities, particularly teachers that were not on a government payroll. They needed to seek other employment, or they had to return to their families. Some came back to those communities once schools reopened. Some came later, but others never returned. So it's very important during this particular stage right now to try to minimize the movement of teachers so that they can come back when the schools reopen, as well as students. In Sierra Leone, the most vulnerable were impacted by crisis, and you see this around the world with any type of crisis. But in the situation of Sierra Leone during this outbreak, poor families were the most impacted economically. Some struggled to have food or access to healthcare services, and pregnancy rates increased among teenage girls due to schools being closed for a long period of time. Teachers take on multiple roles and responsibilities and need proper preparation and support. And this needs to be recognized during this time. Teachers not only are responsible for teaching and supporting learning in a way that is different than what they are accustomed to, but they also have to take on other responsibilities. For example, teachers were trained to support continued learning during school closures, help with safe school reopening, conduct psychosocial monitoring, monitor students' health, and then after schools reopened, they had to learn a new curriculum, an accelerated curriculum with scripted lesson plans. So teachers who take on these additional roles, combined with other pre-existing challenges they had before the outbreak, this can be contribute to a very low sense of well-being and low motivation. So what you will do depends on how much you engage and support teachers, and that will determine how effective you will be. Finally, the crisis was an opportunity for positive change and reform, and this is also seen worldwide in situations of crisis when flaws in the system can be brought to light and inequities. So for this, crisis can be an opportunity to make change. And in Sierra Leone, this one example was that schools that had not been registered and approved by the government prior to the outbreak were able to register with an expedited process for registration. So more schools became registered after the outbreak. Also, a new syllabus was developed with scripted lesson plans, which was something teachers needed and did not have prior to the outbreak. So this was also a positive change. So those are just a few of the lessons that have come out of that time period, and what I feel were particularly important.
Nice. Thanks, Ashley. I feel like you kind of really captured the fact that all aspects of a school are going to change after reopening. I really what you spoke about the roles and responsibilities of teachers changing really resonates with me as someone who does and manages a lot of teacher training. We're working with teachers and asking those same questions now about how can we keep teachers safe? How can we prepare them for the host of tasks that they're going to have and be responsible for when the schools reopen? I also love the point that this, among all the challenges, that there is opportunity in this to reform and refine the way our schools work, and especially when it comes to inclusion and access, that there are absolutely ways that we should be left behind, and we can move forward in brighter, better ways. Thanks for that. My next question, kind of building off of the first, is what specific factors should be considered when the schools are allowed to be reopened?
Great. Well, I think as everyone starts planning, the most important is keep in mind that the primary goal for safe reopening of schools is to keep COVID-19 out of the schools, whether it be a learning center or government schools or schools and refugee camps. All schools need to have this as their primary goal. In doing so, we need to recognize and understand that schools or whatever learning environments you're working in are going to look, as you said, very different. They're going to look and feel very different than what we're used to. And so I think we need to prepare ourselves for having a new vision of what schools will look like. So to make that transition successfully is going to require shared goal and vision of what that is going to look like in your context, joint community and school effort with everyone working together towards that same goal, advanced planning and proper preparation, as I mentioned earlier, and coordination with the local health authorities to ensure that your preparedness and response plans align with the health and safety protocols. And then teacher voice and involvement in decision making. As I mentioned, that if you're not involving and supporting teachers and including them in this, it's not going to be effective. So school leaders and communities can start now if they haven't already started developing their plans. There's a lot of factors to consider when you're developing your plan. Here's a graph of some that are commonly suggested in guidance that are being distributed that you can consider. These are based on WHO and UNICEF, combination of different guidance that have come out recently. I'm not going to go through all of these, but would like to just highlight a few. In addition to having a clean and safe physical environment, if you want to look at social emotional health and well-being of teachers and students. Some teachers and students might come back to school and be fine. However, others may have faced hardship or trauma during this time, either due to the extended social isolation or limited access to essential services, or maybe they lost a family member. And these combined with their other challenges that they have will affect their overall well-being. So for this, you need to have some sort of referral plan of where teachers and students can go if needed, and think about what training and preparation teachers need to be able to monitor and support children's well-being. Another important one that I'd like to highlight is communication and key messaging. A communication plan with key messaging points for students, parents, and family members should be developed so that everyone is aware of the health and safety protocols and any changes that you've made in the school situation. This includes messaging about how disease is permitted and the importance of not coming to school if there are symptoms, and need to think about how these messages can be distributed in an inclusive manner and timely manner. So, be sure to consider student ages when you are distributing these messages. For younger students, how are they going to be informed of what they need to know? This is particularly for younger students. This is going to be the most difficult. Learning not to touch each other when they're back in school, and disabilities or language groups and those who have different forms of communication. Some may not have access to phones or mobile to get the messaging. So how are you going to get those messages to ensure that everyone in the school population is informed? And then finally, I'd like to just highlight flexible policies. Depending on your situation, school policies and norms will probably be adjusted and will need to be flexible. So you want students to return to school, but we want this to be done in a safe way, and one that ensures that all students can return. So some examples of flexible policies: you might change your admission and attendance policies that recognize the challenges faced by marginalized students or individuals at risk due to medical conditions. If you have students or teachers, or if you have teachers that are over 50, for example, they may, what can you do to make sure that they are not at risk? School catch-up classes and accelerated learning for students who come back to school later than others. What are some of the things that you can do to be more flexible for them? And then those who may be at risk and are not actually able to come back to school, what are some alternative learning options that you might consider for them? So those are just a few that I wanted to highlight that might be important to be thinking about right now.
Great. Thanks for that, Ashley. I feel your point about how information is communicated is so critical here on the border where you have the intersection of so many languages and ethnic groups. Even the modality of how the information is shared. So we found that in migrant communities where parents have very low literacy rates, even if something was translated in print, that information is not necessarily going to clearly get to the parents who, as you mentioned, need to be involved in the intervention. They're at the heart of it. So we're looking at video as a means to get critical information to parents and younger children making sure that they're clear and they can contribute and understand the situation. So thanks a lot for that. I have one more question for you, and this is looking at specifically for school leaders. So could you recommend some key questions that school leaders should think through as they prepare for reopening?
Yes, great question. I put together a list here of some things that I felt were most important at minimum. This is, of course, not an exhaustive list, so there are other things that you'll need to consider. But just to start thinking about this, the first thing is, do you have the procedures and protocols in place for different things that you need to consider in terms of school entry and health screening? Will you control people coming into the schools? And what needs to be done to prepare for this? What hygiene practices and respiratory etiquette are you going to ask of students and teachers? I think the Thai government right now is suggesting everyone in the public needs to be wearing cloth masks. So, are you going to have enough masks for students and teachers? What will social distancing look like in different parts of the school and different routines of the school day? How will students sit in the classroom? What would lunch look like if you're going to serve lunch? Are you going to have recess? And if so, what is that going to look like? If social distancing is something that will be challenging because the learning environment is already overcrowded, then what adjustments to the school day will you need to make to minimize the number of students in school at any given time? So, for example, for this, you might consider reopening schools in phases where certain grade levels start first so that you can use other classrooms, or you might rotate days between grades, or you might do what they call double shifting, though this can be challenging for teachers to be teaching all day to two different groups of children per grade. So, thinking about what it is that you can do to minimize the number of students. And I think this is the one that's going to be the most challenging to plan around and think about. And it's going to make school look very different. Regular cleaning and ventilation, you'll need to have a schedule of cleaning, particularly heavily trafficked areas. I think normally by the hour is recommended, but at least once a day or as regular as you could. Monitoring health and well-being. Who's going to monitor to make sure that teachers and students are okay? What are types of things that you need to be looking for? And what is a referral process? Where can you direct teachers and students that may need extra help and support? And then finally, responding to sick students or staff. What are you going to do when students start showing symptoms of not feeling well? You may need to have an area, you will need to have an area that is isolating, that isolates them until you can figure out what are next steps. But you need to do this in a way that avoids stigma, because we don't want students to not want to report symptoms. And so it needs to be a safe process and one that's not going to create some sort of stigma or negative feeling amongst students. So those are things that you're going to have procedures and protocols in place for, and people are going to need to know what those are. And then you need to have the adequate equipment and supplies for how you're going to help screen. What do you need? Thermometers, clean water, sanitation, and hygiene facilities are going to need to be in place if they're not already, and these are going to need to be cleaned regularly. Hand washing stations at different points, and then of course all the cleaning supplies and disinfectants that you'll need. And then, are all school personnel trained and prepared? Are teachers prepared to diagnose students, how to monitor for psychosocial health and well-being, and what to do if children are sick? So teachers are going to need to be trained on all of these procedures and are aware of what they are. And then, do all parents and students have the right messaging? The most important one that needs to go out to parents and students is not coming to school if they are sick. So these are just a few things. Of course, it's not exhaustive and does not include the other aspects that you'll need to think about in terms of what teaching and learning will look like, but just to give you an idea of what you're going to need need to make sure that your school is clean and safe.
Thanks for sharing this list, Ashley. I feel like it works as a great kind of checklist for school leaders to make sure where they're thinking through a lot of these details of everyday school life. And I feel like what you mentioned about social distancing and scheduling, I mean, those are heavy questions that schools really need. I mean, there's time here in Thailand with schools set to reopen July 1st for school leaders to think through a very different schedule for their school, especially schools that are very crowded, right? How can you keep student desks or seating areas so that they are 1.5 meters apart in classes where there's over 30 students? This is going to be one of the main challenges the migrant learning centers face. Just quickly, this list and some of the information that you've shared with us, what kind of frameworks or what resources are you using in developing these recommendations?
Yes, so WHO has, obviously gives the guidelines for how to reopen any kind of work environment and safety and all the protocols that need to be in place. And based on these UNICEF and UNESCO and different and World Bank and World Food Program, they typically put out most updated guidance for schools. So those should be available. There are two right now that have recently come out in the last month. One is by WHO, UNICEF, and IFRC. And this one is really important in terms of giving key messages and actions for prevention and control in schools. And has those kind of checklists similar to what I've given, but actually have a lot more other things you might think about. And then UNICEF has recently put out a framework for safe school reopening. These are two, but there are several. And there should be one coming out that's Thailand specific, I would suspect, from both the government and maybe also UNICEF might have one that comes out, or UNESCO. So these are just a few of the resources that I would suggest.
Thanks so much, Ashley. I feel this has been, like you mentioned, the Ebola crisis and the COVID-19 crisis are totally different, but I think you've articulated really well what are some of the lessons we can glean from that crisis that we can contextualize and adapt to the schools, the learning centers that we're supporting here. So thank you so much for joining us this morning.
Oh, thank you, Greg, and best of luck.
Great. And to our audience, thank you so much for tuning in. Whether you're a teacher or a school leader or in a position to support teachers and school leaders and children, I hope that this conversation has helped guide your thinking, giving you some things to think through, especially when it comes to the details and the challenges that schools will face once they reopen. So thanks for joining us.
Thank you.